Tell me about your headaches.
Ever since I've had optic neuritis, the first episode, sometimes they are absolutely unbearable. It's front part, you know, lots of pressure, pain behind my eye, and I've had them for about 7 years now.
Now you said ever since the optic neuritis. Before you had optic neuritis, when you have inflammation of the optic nerve, did you have headaches?
I had headaches when I was a teenager.
What kind of headaches
all the
were
way back
those?
to sometimes disabling to where I couldn't get off the couch.
Okay.
You know, but at that time, I was 16, 17 years old and never dreamed I had anything like this wrong with me. Went to the eye doctor, got glasses, and they improved some, but not a whole lot. But after the optic neuritis was when they increased.
And the headaches, let's go back to when you were teenage years. Do you remember, were they connected at all to your menstrual periods?
No, sir, they were not.
Okay. Were those headaches throbbing? Were they sharp?
It was
They
throbbing. Sometimes they would be sharp. It was always the front part of my head.
And how often would you have them?
Pretty often, maybe 2 to 3 times a month.
Okay. And how long would those headaches last for?
Usually a day.
Did they stop you from doing things that you wanted to do?
I think I missed quite a bit of school from them when I was, you know, a teenager still at home, and they did stop me from doing things, yes, sir.
Do you remember, did you have light sensitivity or sound sensitivity?
I can't remember.
Okay. How about nausea or vomiting?
No, sir.
And did anyone ever give a name to those headaches?
No, sir.
Anybody in your family with headaches?
Not like I have, no.
Okay. And so those were when you were 16. Did they, when you got the glasses, did they really settle down a lot, or?
It settled down some. It wasn't as severe as before.
So in your 20s, how often would you have headaches?
I can't remember.
Okay.
Can't remember, but I know when I got to my 30s, you know, I was starting to have them again, and then after I had the optic neuritis, they greatly increased.
When you say greatly increased, what do you mean?
Every day of my life.
Okay.
It's not
Same types of headaches, or they felt different?
same types of headache.
Okay. And were they in the same place in the head?
Yes, sir, same place. And then I'll have a great deal of pain behind my eye.
Okay.
And sometimes I'm not sure that doesn't cause the headache from all the nerve damage behind it.
Now, is it behind both eyes or behind one eye?
Just
or
the
other?
left eye, sir.
Just the left eye.
Yes, sir.
Okay. And when you have the headaches, do you always have that pain behind the left eye, or sometimes you don't have it?
Always have the pain behind the left eye.
Okay. And so once you started having the optic neuritis, you started having headaches every day?
Yes, sir.
And right now, do you have headaches every day?
Every day. It's never went away. It's always there. It's like a dull pain. Some days it's worse than others. You know, some days I'll have to use ice packs or heating pads or increased medication, but I have a headache every day.
When you say medication, what kind of medication do you use for the headaches?
Ibuprofen, Tylenol. I recently just started Norco. I've not started that until like the last month.
And the ibuprofen, Tylenol, how often would you say you're taking them?
Before the Norco, probably 3-4 times a day.
Okay. Has anybody ever talked to you about something called medication overuse headache?
Yes, I know what rebound headaches are, and yes, sir.
Have you ever been told that you might have rebound headaches?
No, sir.
Okay. Have you ever been on anything to prevent the headaches?
Yes, Topamax.
And what happened with that?
The side effects of it are pretty severe,
Okay.
so I stopped it.
Okay. Any other medications trying
sir.
to prevent?
No, sir.
Anything else like acupuncture, anything
No,
else
sir.
to try to do that?
No, sir.
No. Okay. Have you been given a name for the headaches that you have right now?
No, sir.
Okay. And have you noticed that they kind of get better or worse depending on the time of the year?
I'm always, like, my symptoms are always more severe in the cold weather months. The biggest relapses I've had have been in the cold weather months. Even though the heat's hard on me, it seems like the cold's worse.
Tell me about your headaches.
So I've had headaches since I was a teenager, on and off, and then after I had the optic neuritis, they greatly increased.
Let's go back to when you were a teenager. Do you remember when they started?
I was probably 16, 17.
And were those headaches associated with the time of the month, like with your menstrual
No,
period?
sir.
Do you remember what types of headaches they were? Were they throbbing? Were they sharp? Were they dull?
The best I can remember, they were throbbing. sharp.
And do you remember what part of the head they affected?
It was always the front part.
The front part
Yes,
of the head?
sir.
And did you take any medications for them back when you were a teenager?
I don't think so.
Did they stop you from doing things? Did you miss school because of them?
I did, sir.
Are there other people in your family who have those types of headaches?
No, sir.
Did you notice any visual problems with those headaches?
I can't really remember that far back if I did or not. So,
So that was when you were a teenager. Do you remember what happened in your 20s?
no, it seemed like it was around my 30s when I started having the headaches again.
Do you think they went away for a little while?
Maybe for a little bit, yes.
Okay. And when did they start coming back in your 30s?
Probably early 30s. And then I had the initial onset of optic neuritis when I was 35. And I've battled headaches ever since then.
So what changed about the headaches after the optic neuritis?
The pain is a lot worse, especially with like optic nerve pain behind my eye where I had the optic neuritis.
And when those headaches happen, are they happening every day, every other day? Can you give us an idea of
I
how
have
often?
some type of headache every day.
Now, is that headache dull? Is that headache sharp? Is it throbbing?
It's more like a double.
Okay. And does light bother you with those headaches?
No,
How about sound?
no,
How about strong smells?
no,
Do you ever feel like vomiting or have nausea?
no, not with the headaches, no, sir.
How about your skin? Is your skin sensitive to touch with the headaches?
Sometimes.
Where?
Well, up in here in my neck,
And what do you want to do when you have the headaches?
I had to take ibuprofen or Tylenol, and recently have started Norco. I didn't start it for the headaches, though. I started it for leg pain.
And how about the Tylenol and the ibuprofen, the acetaminophen and the ibuprofen? Do they make the headaches go away?
They do decrease them. It never really goes away. Sometimes I've had to use heating pads, ice packs.
Have you noticed anything that triggers the headaches that makes them worse?
No, sir.
Anything that makes them better besides the acetaminophen and the ibuprofen?
The ice packs and the heating pads will when I use those. I can be in the heat all day long and I'll have that headache with that decrease in vision.
Do you notice any other kind of visual symptoms? Do you have any kind of warning sign before the headaches?
No, sir.
And when you're doing things that exert yourself, when you're out and about and doing things out in society, do the headaches get worse?
Yes, sir.
So do you think activity makes the headaches worse?
Yes, sir. Especially if I get hot when I'm trying to do some type of activity, I'll have that decrease in vision that almost always comes with that pain behind my eye.
How much do you think vision is associated with your headaches?
Quite a bit.
Why do you say that?
Almost always have that pain behind my eye when I have the headache. And if I've done too much, then I'll have that decrease in vision in my left eye. It's almost like it's foggy.
Your vision is foggy
Yes,
or your
sir.
head is foggy?
My vision is foggy.
Do you see the visual problems as separate to the headaches, or do you see them as one and the same?
One and the same.
Okay. What have you tried to do to prevent the headaches?
I tried Topamax for a little bit, but the side effects were pretty brutal from it. So I stopped that medication.
Did you try any other medication?
No, sir.
You said that you use acetaminophen, ibuprofen. You're using those daily? You're using them close to daily?
The ibuprofen I probably use about every other day.
Okay.
Some days they're bearable and I don't have to take anything. It's a pain that never goes away. But sometimes I can manage it. But like as yesterday, I couldn't, so I took an 800 milligram ibuprofen last night because it was almost disabling.
Have you ever heard of medication overuse headache?
Yes, sir.
And do you think that you have that?
No, sir.
Why not?
I'm very stubborn about medicines, and my pain levels are pretty tolerable. And every time I have it, I have the pain behind my left eye.
Okay. Okay. But you're using those medications daily or close to daily?
I use them often.
Okay.
But I know what rebound headaches are. I worked in healthcare for a pretty good while. So, and I don't feel like it's that.
Okay. Some people with headaches, they say that their vision changes before the headache. They have something called an aura, like a warning sign that they're going to have that. Do you think that describes you?
I do.
How so?
I do. Well, I'll have that foggy look in this eye, especially if I've overexerted myself. And when I do have the optic neuritis, I have a massive headache that comes with it. And when I start the IV steroids, it's usually gone after the first treatment.
Okay, so when you take the IV steroids, the headaches go away, and how long do they go away for?
I'll usually be headache-free or as headache-free as I can be for probably a month or longer.
And then what will bring the headaches back?
It just depends on what I've done. You know, if I'm outside working in the yard or in the pool, or if I get too hot, if I take a hot shower.
So it's that your overheating brings back the headaches. It's not that you have another bout of optic
brings back
neuritis.
that vision, that fuzzy, whatever damage I have to the side with the vision.
So whenever you have the uncovering of the optic neuritis, so not necessarily a new optic neuritis, but an uncovering of those symptoms.
That's correct, sir.
That's when you have the headache as well.
Yes, sir.
And so that's why you see the headache is really a symptom of the optic neuritis.
Yes, sir.
Tell me more about your diagnosis. You started with one diagnosis and then people weren't so sure. Tell me how that feels.
It's been very scary. It's been a very long, hard road. Initially, you know, it was the MS, and I was on several different MS medications, and I kept failing therapy, and then I had a huge relapse in December of 2017. I threw up 21 days straight. I was convinced I had stomach virus, that I'd picked it up somewhere, and so I'd seen a neurologist at home, and very intelligent fella, and when I went back to him afterwards, which I went into 3rd degree AV block, ended up with a pacemaker, he said, "Tiffany, I've never seen MS do to somebody what it's done to you. He said, I don't know what to do for you anymore." So that was when I found Dr. Hunter, and I have not a doubt if it wasn't for Dr. Hunter and the gift that God's given him, I wouldn't be here.
Well, that's certainly a blessing. What made people at first think that you had multiple sclerosis?
I had lesions on my brain and the recurrent optic neuritis. So the ones on my brainstem didn't show up until 2017 that we know of.
How many times do you think you had optic neuritis?
20 plus.
20 plus separate times of optic neuritis?
In 7 years.
Okay. Always in the same eye or in both eyes?
Always the same eye, left eye.
And what's the first symptom that you usually feel?
That disabling headache.
Okay.
And you can just about bet I'm going to wake up the next morning and have no vision.
And when you say no vision, you mean no vision whatsoever, or
No,
just
like
decreased?
my central, it's gone. The first time that I had the optic neuritis, I lost all my vision. And I started high-dose steroids a few days after that.
And for all those 20 times, have you had steroids each time?
Yes, sir. Every single time. I went to the eye doctor, came here, and I've had IV steroids every time.
And what treatment are you on now for this?
I'm on Rituxan, Cellcept, and I take daily prednisone.
And you think these are helping?
I think the prednisone helps me tremendously. And
How so?
Every time I try to come off of it, I relapse. So, or every time we try to wean the dose down, or and my MRI showed improvements, so the Rituxan and the Cellcept, I'm sure, are playing a part in that also.
Have you had problems with your spinal cord as well, as far as you know?
Yes, sir. That's the brainstem where the lesions are. It was, I think, 15 benign initially.
Okay. And do you ever get a kind of a tightness feeling?
I don't have that, no, sir.
You don't have that hug feeling?
I've read about it, but I've never had it.
Okay. And what do you think's next for you?
Worry, because it's constantly a worry. When you have a diagnosis that's rare and you can't pick the phone up and call somebody else that has it and compare symptoms, or I do have an appointment to see a counselor coming up soon because I feel like I've dealt with it as long as I know how. Because, you know, I had a career in healthcare, and I'm not able to work anymore, and I've gained lots of weight from being on the medications, and it's been a lot to deal with.
Yeah.
So,
what do you hope to accomplish with the counselor?
Maybe how to deal with it, not drive my family and myself crazy, because every day I get up and I worry what's going to happen next.
And what keeps you strong?
Probably my kids, my husband, mom and dad.
Is religion at all important to you?
Absolutely.
How has religion helped?
I think God's brought me to where I am, so. And I don't think if he gave Dr. Hunter the talent to treat me, so I pay a big, big, big thank you to him. I don't think I would have been here if I hadn't have found him. I was really, really sick when I first started coming to him. Was in physical therapy, learning to walk again. Let's see, I just had the pacemaker put in, which, I threw up all those days and everybody thought it was my MS. Which I argued that was the stomach bug the entire time.
How was it going back to family members and to friends and saying to them, well, I know I told you I had one diagnosis called MS, but now it looks like I have another diagnosis?
I explained it to him like Dr. Hunter told me. He said it's like MS on steroids. So that's just, which my mom was with me when I initially found out, and I had to go back and tell my kids, so.
How do people respond to the...
Nobody knows what it is. They look at me like I have four heads. So even when I go to like a healthcare provider at home, or not my family doctor, because I worked for him for years and he researched on it to be able to take care of me, and he stays in contact with Dr. Hunter. But if I go to like urgent care, and I tell them I have the neuromyelitis opticus, I have to be careful what medicines I take. And they never heard of it. When I started going to the pain clinic, the first words that the doctor said, he was very young, he'd read about it in a textbook, but he'd never seen anybody with it.
Okay. And how does that make you feel to hear that a doctor has never seen somebody with your problem?
I can't even describe it. It's hard to deal with. And I deal with it the best I know how.
And what do you use to deal with it?
My family. I just started Cymbalta, but as far as like medicines, anything else, then, they don't really help me, or I don't feel like they have.
Okay. Okay.
But it's been a hard road, like a very, very hard road.
What do you think the future holds for you?
I hope not a wheelchair.
Okay.
So I've started having some great difficulties walking. But I started physical therapy this week, and
okay.
But I hope not a wheelchair. And that's Dr. Hunter and I just discussed that last week. So. And I'm going to keep doing what he tells me to do.
And did you work out with your physical therapist kind of goal of treatment?
She's working on that this weekend. I saw her the first time yesterday, which I did physical therapy last year because I practically had to learn to walk again. And when I go back to her Tuesday, she's going to have a goal of treatment. She thinks I'm going to have to stay with her long term this time, though, just because I have so much deconditioning and weakness from the disease.
Okay. And what would you say your biggest struggle nowadays is?
I have a 2-story house, and it's horrible going up and down my steps. And not being able to do the things that I once could do. Like my son's playing football tonight, 3.5 hours away, and I would have never missed one of his ball games 2 years ago, and tonight I'm not going. I can't hardly make the ride.
How do you feel about the neurological problems? Before it was called MS, and now it's being called neuromyelitis optica. How do you feel about those diagnoses and what they've done to your life?
It's very scary. I mean, it's taken my career away. I'd worked for 20 years doing billing and coding, and I can't see as well anymore. Some days I can't even get out of the bed. It has definitely changed it.
Okay. Any advice for other people who are facing the same thing as you or similar?
Don't give up.
Okay.
See Dr. Hunter, no matter where you're at, don't give up. Because he's done tremendous. I mean, I was really sick when I first started seeing him, and he's done tremendous things for me.
Don't give up. Well, thank you so much.
Thank you, sir.
Thanks a lot.